episode number 30 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. My next guest today is Dr. Kalea Wattles. Dr. Wattles is a naturopathic physician specializing in women's health, fertility, and functional medicine. She earned an undergraduate degree in nutrition and a Doctorate of Naturopathic Medicine from Bastyr University, followed by additional education from the Institute of Functional Medicine. She also has advanced training in craniosacral therapy and breastfeeding medicine. Dr. Wattles is a firm believer that women deserve to have it all: family, career, and abundant good health. She holds dear the philosophy that fertility isn't all about making babies, and that knowledge of their fertility status empowers women to make informed decisions about growing babies, businesses, dreams, or whatever it is that they're hoping to bring into this world. Dr. Wattles serves as a clinical director at the Institute of Functional Medicine, where she develops curriculum for advanced training in male and female hormones, thyroid, and adrenal function and gut health. She is currently building her new medical practice, Functional Fertility, offering fertility-focused telemedicine. In her spare time, she enjoys exploring the Pacific Northwest with her husband and 2 daughters. So welcome to the podcast.
Thank you. I'm so excited and honored to be with you.
So really cool. I was taking a look at your stuff, and you have a really cool Instagram, which I absolutely love. It looks
a lot
so
of
pretty.
fun.
You do such a good job.
Well, thank you. It's my creative outlet where I let the creative part of my brain come through. So I have a good time.
But you're really good at it, I have to say.
Thank you. Thank you.
So can you share your journey of how you got to working in the field of naturopathic medicine and then specialized in fertility?
Sure. Yeah. So I actually started kind of my healthcare journey by studying nutrition at Bastyr University, and I just naturally gravitated towards women's health. And so much of my training was geared towards hormone balancing and preconception, maternal and pediatric health. And at the time, I was in my mid-20s, so I was in that zone where most of my friends were, starting families and trying to get pregnant. And being that I was in this health science field, people were coming to me, letting me know that they were having trouble. And I started to realize that young women were having trouble getting pregnant, these women who I would consider to be in the prime reproductive age. And then I started hearing the same story from my colleagues. And these weren't just any women. This isn't the general public, right? These were women studying at one of the most prestigious health science universities. So they have all of these tools and resources, and they're still struggling. So my eyes really opened to the fact that women need fertility support. We're not trained. We aren't given the information of how we maximize our fertility potential from a young age. And so then when I was earning my doctorate in naturopathic medicine, I chose to spend the majority of my supervised hours with reproductive endocrinologists in some of Seattle's top fertility clinics, which was an invaluable experience because I saw, when you have to escalate the level of intervention, I saw what they do. And while there, I realized all of the impact that I could make using lifestyle medicine. I was seeing so many women with hypothyroidism and insulin resistance, even low vitamin D, type A personality, super high stress, business women, hormone imbalances. And so while I realize that subfertility isn't always lifestyle related, there's almost always something that can be done to maximize fertility potential, whether you're in the preconception phase or at the IVF stage. And one kind of model that I love to talk about is that fertility is a spectrum. And, at one end of the spectrum, we're less fertile. And then at the optimal side, we're at our maximum fertility potential. And I always tell people, wherever you are right now is just a snapshot. There's so
That's such a good point. I like that.
Yeah, there's so much that we can do to push you to the more fertile end. And I think that concept helps people think about fertility as a dynamic process that's flexible and that we have some say in it. And so that's kind of what brought me to naturopathic medicine and to fertility in specifically.
Right. That sounds like that is a really great way to look at it, because it is a snapshot, and I think that sometimes it could be modified with just diet or certain lifestyle changes, and so it really does it puts things into perspective.
Yeah, yeah. And I hear, when women are struggling with their fertility, one theme that I hear often is that they feel like they've lost control, that they don't
Yes.
have control over what's happening. And I think if we use this spectrum model, it helps us to understand that we have power over something. And
Hmm.
even if it ends up in you're undergoing IVF, there's so many things that we can do to make that more effective and to reduce stress and to support you as a whole person as you're going through that. And I think there's something empowering about that.
Absolutely. I agree with you 100% about that.
Yeah, it's a big deal.
So, what do you do as far as naturopathic medicine? What does it encompass when somebody comes
Mhm.
in to see you?
So I love to give a little overview of naturopathic medicine because not everyone has access to naturopathic medicine or has seen a naturopathic doctor. So I love to give a little bit of a background about what that means in general. And so
Hmm.
I like to tell people that naturopathic medicine is a healthcare system that utilizes natural therapies in combination with modern medical science. And I really like to underscore that part that, we have so many tools in our toolbox, and that might mean functional nutrition,
Hmm.
botanicals, physical medicine, pharmaceuticals, mind body medicine. We have so many interventions that we can choose from.
Hmm.
This approach to medicine is really rooted in the concept that we can harness the body's own innate ability to bring about self healing. And something that I think makes naturopathic medicine really unique is that we're guided by a set of 6 principles. And I'll just really briefly talk about those because I think it helps give a good idea of how we practice medicine and how it's different.
Hmm.
So the first one that I love is the healing power of nature. Like I said, at the core of naturopathic medicine is the belief that the body has this inherent ability to heal, and that my role as a naturopathic physician is just to remove obstacles to that healing.
Yeah, I
Which
love that. I say that all the time. It's true. Yeah.
is so true. And I think a lot of times the obstacles that are there, we don't even realize we're there until we see it on paper or we have some revelation. And then it's like, gosh, this has been really holding me back. So my role is to help guide people to first the self discovery of what obstacles are even there, and then
Hmm.
figuring out how we can shift those, and then giving the body the tools that it needs to facilitate this healing process. And I think those tools can mean and do mean different things for everyone, right?
Hmm.
So the next principle is identifying and treating the root cause. And naturopathic doctors are really trained to continually search for the cause of a patient's illness rather than just providing symptom control.
Right. Yeah.
That brings us to the third principle, which is first do no harm. And in order to do that, we're trained to use the treatment that's the most effective, the least invasive, and has the lowest risk for side effects or toxicity. And I always tell people, I think, sometimes we need to use pharmaceuticals and people are surprised that a naturopathic doctor would recommend that. But I always tell patients, we have to meet the level of the problem with our intervention. So more serious problems, we have to escalate things to a higher order intervention.
Right.
We're always going to choose whatever we can that's going to be the most effective and the least side effects.
Right.
And then we get to probably my most beloved principle, which is docere, and that's doctor as teacher. And
Hmm.
naturopathic physicians, I think a strength that we have is we really understand the importance of educating patients so that they feel empowered to really actively participate in and take ownership of their health journey. And once you're engaged in your own health, it shifts the locus of control more internally, like we talked about before, which I think can really reduce anxiety for a lot of people.
Yes.
So that one's really important. And I just love, I think people have chronic health conditions that they've maybe had their whole life. And then you draw a chart or you show them a visual and some light bulb clicks and it's transformational that they feel like they understand their physiology and things make sense. And it's such a game changer. So doctor as teacher is very special. The next one is treating the whole person. And I think that many of us in the integrative and alternative healthcare fields, we know that every person has a unique set of factors that contribute to their personal health journey and make them who they are. And so we always consider those determinants of health, whether that's, physical, mental, emotional, genetic. And then we seek to support patients in all of these areas for a really comprehensive approach. And I think it's really important that people are a sum of so many parts, and we have to think about all of those determinants.
Right.
And then the last principle, which is, last but certainly not least, is prevention. And naturopathic physicians focus on preventing disease by identifying unique risk factors by looking at those health determinants, and then we can support overall health to hopefully prevent disease. So that's naturopathic medicine in a nutshell. I know that's a lot, but I think that
it's great information.
That I feel so lucky to do this medicine.
That's awesome, because a lot of these things that you said, we as acupuncturists completely believe, which was number one, really struck a chord, because it's something that we always say is that we don't actually do the healing. It's the body that does the healing on its own. We just facilitate an environment where the body's able to do that. And, the world that we're living in, there's a lot of stressors, whether it's mental, physical, toxic, so many different levels. So I mean, what you said makes so much sense on so many levels. So thank you for sharing that.
Yeah, thank you for letting me get that out there. I love how you said that we're just facilitators. I mean, that's what it is. And it makes me think of, I guess I'm all about analogies today, because I always talk about how you said we have all of these sources of stress. And I always talk about that as a bucket. And we're always pulling, sources of stress into our bucket. And one tool that I can give patients is to help you drain the bucket, so that next
I love that.
stress or a drop of fried food or whatever, your bucket's not overflowing, because we're always working to drain the bucket from the bottom. So I think we can relate to each other a lot in that analogy.
Yeah, 100%. I mean, that really is a great way to put it. And I love the fact that you put the power back into the patient's hands, because I think that that's missing a lot of times just in modern medicine. It happens a lot where they don't really know what's going on. They just put their 100% trust in the practitioner. And it happens a lot with all kinds of different medicine. And it's great to know that they can be part of it and that they have ownership, because I think that that's true lasting change that brings about much more of a lasting healing effect.
Absolutely. Because it's authentic and it's real. And I always, I tell patients, question everything. Question me, question your other care providers, like ask why.
Yeah.
It's important to always know why you're doing what you're doing. And so I think that authentic change is exactly what you're saying. It's long lasting and it's real.
Right. It's true. It really does get to the core. I mean, it really gets, it has them embody the medicine.
Exactly.
So what do you do? What's the next step after, once you have somebody there? So you work on diet, on a lot of different levels, functional medicine, supplements.
Yeah. So, I mean, there's so many ways that we can go with a fertility assessment. I think obviously we're going to collect a medical and fertility history, just like any, practitioner would do. We also have, functional labs that we can run. But I think what's really special about functional medicine and why I'm so grateful for functional medicine is that it's based on a system-based biology approach. So that helps me to identify which body systems need the most urgent support. And, we have a tool in functional medicine called the Functional Medicine Matrix. And it's an actual piece of paper where we kind of map out all of the different systems in someone's history and their background on this document. And it helps us to think about things like assimilation and communication, so hormone balance, energy production, biotransformation and detox, or even their structure. And that could be, the structure of their internal organs, or even the cell membrane, like the structure of their actual cells. And we can really target where it is we need to go next. What is the body system that needs the most support? And we know because all of the body systems are connected to each other, that when we create change in one system, it will roll over into the other systems that need support.
Right.
So
Yeah.
one example we talk about in functional medicine all the time is, how the adrenals and the thyroid and the gut are all related. And when we target which of those needs the most support and we start giving it, whether it's, nutrients or detoxification pathways, how we start to see improvements in the other systems, even though we didn't specifically work on them. So
Right.
I think that's the benefit of functional medicine. And I love the combination of naturopathic and functional medicine together, because it allows us to kind of identify the root cause of the disorder and then support it in such a holistic way.
Right. And do you work with herbs as well?
Yeah, so I love botanicals, and I feel like they are well suited to the fertility realm because, we can use botanicals that are very medicinal, but we can also use botanicals that are culinary, our anti-inflammatory,
Right. Yeah.
even ginger. And so with someone that's trying to get pregnant, where we might, be a little bit cautious about interventions that we would use, nutrients and botanicals, there are so many safe choices.
Right. It's true.
So that's really special. And I know you and I had kind of talked about underlying gut conditions, for example, and that affects hormone balance. And I feel like with, a functional medicine approach, we can look at things like gut health and all this emerging evidence with the estrobolome, which is a concept that I'm really fascinated with lately, with our gut microbiome and having bacteria within the gut that are capable of metabolizing hormones. I know you've talked with other guests on this podcast, and it's just fascinating to know that our gut bacteria is affecting our hormone balance.
Yeah. It's crazy.
It's just an intricate process. And I was actually just reading all of these articles just to kind of bring that full circle about leaky gut, for example. And I think, when someone is being worked up for fertility, we don't always think about, oh, well, do they have leaky gut? But then there's all of these papers that are coming out showing that, if you have leaky gut, you have this chronic low-grade inflammation, and then that inflammation is driving the insulin resistance, which impairs ovarian function. And then the hormones are disrupted, and then the constellation of symptoms that women with PCOS are experiencing are exacerbated. And so, this is
It's a chain reaction. Yeah.
And
it takes a while
yeah.
to work out. It takes a while because it's been so long and it's chronic. So it definitely takes I always say at least 3 months, but it's more than that.
Oh yeah, it's to reverse that level of inflammation that, like you're saying, has maybe been going on for 20 years or more. And that's actually a great point, because people ask me all the time, I want to get pregnant, I want to start trying and get pregnant, I want to get pregnant in a month, and maybe that'll happen, and maybe that's great. But I always say, let's do a preconception plan. And we know that, sperm and eggs take 90 to 120 days to develop to full maturity. Let's give them the best start possible and start a preconception plan 3 to 4 months before you actually start trying to conceive.
Right.
Let's give them the best shot possible.
Yeah, 100%. I'm so with you on that, because I compare it to, and I love analogies, so I compare it to tending to a garden.
Yes.
You could go ahead and just put some seeds in a soil and not worry about anything else. But if you really clear out the soil, put in nutrients, and really set it up before any seeds go in, the garden is going to be so much more alive and so much healthier than if you just went ahead and just rushed it. So that's how I perceive fertility in general.
I'm going to use that. garden.
It's great. You should go ahead.
I really like that. And it's just, I feel pretty strongly about that. And I had a professor when I was in school in a maternity wellness class, and I don't know why this really stuck with me, but she said, when you are at a point where you're ready to get pregnant, you want to give from a place of fullness. And
I love that.
term or phrase just has really stuck with me. And so I always tell people, let's fill you up before you give to such a great extent to another person. Let's
Yeah.
so that you can give from that place of fullness. And I think that could mean,
Oh, that is so enlightening.
yeah, I
I love
think
that.
about it all the time. And I think it could mean so many things, nutritionally, emotionally, physically, spiritually,
Yeah.
on all the levels that you could be replenished. Let's do it.
Yes, yes, I love that. Really, yes. I mean, that is so great. It's so true. I've had so many people come into my office and they're depleted and they're like, I'm not doing this for myself. I'm doing it for the baby. And I'm trying to reframe your body needs it. Like you need to do it for yourself
Right.
because ultimately yourself is what's going to give life. You have to fill your cup. It's the same kind of thing, you know? It's so important.
Yes, exactly. And that's just on a funny personal note. It reminds me of yesterday. I have two little girls, and I was talking to my 4-year-old, and I said, Mama loves you so much. I built your skeleton from the calcium from my own bones. And
And what did she say about that?
not maybe exactly true, but I think it's useful to think about it
It's
that way, that you only have
it is.
to give what you have to give. And
It's true.
I think I love how you were saying, you're building this new human from what you have in your body. So we got to stockpile.
Absolutely. We really do. I think it's really a paradigm shift
Mhm.
of really kind of taking things into perspective and realizing how we can't skip steps. I think that that's something that's missed. People skip steps.
Yeah.
And I find that in that situation, you get to a point of desperation and you just want to get to the end point.
Right.
And you miss a lot of it. And one of the things that I feel very strongly about is even intimacy. I
Yeah.
mean, there is no intimacy. It's just like timing, let's go, let's move, you know.
I got the
And
positive
but
ovulation prediction
nature
strip.
nature had it so that that was like the first step and you can't miss that first step. It's part of the whole cascade of events.
That I agree with that so much. And I always, encourage couples as part of that preconception phase where you have, 3 to 4 months to get everything in order. Spend some of that time connecting to each other, because pregnancy
Mhm.
is challenging and having young children is challenging, and take this time where it's just the two of you to really connect. And I think that part isn't emphasized enough, like you're saying. And
Yeah.
when people want to get pregnant, they wanted to be pregnant yesterday, right? It's like
Yeah.
we don't forecast enough. And that's why what I really believe, that when we're seeing, women for their wellness visits and for their annual checkups, that we check in about their reproductive goals. So if they say, I would love to be pregnant in a year, then we say, okay, well, in 6 months, let's really dive deeply into this and really give it our best. And so that, we're being proactive rather than reactive.
You know what? That brings up a thought in my mind. You know, if only people would start preparing a year before they really try to plan, but it doesn't work like that. They just do it when they want to do it. They're like, okay, now I want to get pregnant. But a lot of times people, not many, I mean, there are a few people that have looked into prenatal pills and taken them. And there's very few people that do that, but there are. I have met them
Mhm.
where they did that before even thinking to get pregnant, just to get their bodies ready. But the majority, it doesn't work like that. If it did, I think it would be great, you know, because you give yourself that time and say, okay, I'm not ready right now, but I'm probably going to do in a year. And then let me just prepare my body now.
Mhm. Can you imagine? That would be so magical if everyone planned
It would.
for a whole year. And I have to wonder, how much could we change that if healthcare providers were, if they asked more, if they checked in more.
Yeah.
And I know that, there's not time and people are just trying to give the best care that they can. But I think if that was something routine, that when we saw women, we checked in, that
Yeah.
maybe we could do better.
Yeah, I agree. Maybe just bring in some kind of education, just make it more of a thing
Just
so that people don't end up having to struggle the way they are.
exactly. Exactly.
So we do see eye to eye on a lot of things.
Yeah. I love it. It's so fun.
I do too. I know it's awesome. So I love that you say that fertility is not about making babies, because I've always said that. It's something that I've always believed.
Hmm.
And of course, I get it. People that are coming to us, they want to have babies. I try to kind of take the paradigm and maybe shift it a little bit so that at least some of the pressure comes away. And I love that you say that because I've always felt that way. And I've seen many women birth movements,
Yes.
such as Oprah Winfrey,
Yes.
who has birthed a school, and she calls all of those kids, her daughters.
Hmm.
And conception and birth is about so much more than just our bodies.
Absolutely. I love that you brought up that example. This is something I feel really strong about because I think that a really important part of having a fertile body and a fertile mind is to harness your creativity. And, maybe that means building a family, but maybe that means building an empire or both, which is
Right.
would be amazing. And so
Yeah.
I always talk about, fertility is about living your life in a creative way where you're manifesting, parts of you out into the world that serve good purposes. And I think another aspect of this is that we kind of do women a disservice by not being more frank about the fact that there is an age related component to fertility.
Hmm.
We're born with 2 million eggs in our ovaries, and then that's down to 25,000 by age 37. And then,
Hmm.
even more importantly than quantity is the quality. And we're living these high stress lives, not sleeping, eating processed foods, no time to exercise. And, all of those things impair egg quality. And I want
Right.
women to have the flexibility to have the career of their dreams and express their fertility in that way, but also to have the family that they want when they want it. And
Right.
I feel like we need to talk about this because we're at this special point in history where we have all of this knowledge and all of these options. And I feel like it's my duty to present that to women so that they know, for example, we know how to test for things like ovarian reserve now. We can look at,
Right.
anti-Mullerian hormone, which for listeners who aren't familiar with that, it's a hormone that's produced by granulosa cells in the ovary. So those are basically the helper cells that support an egg as it's developing. And the level of anti-Mullerian hormone that those granulosa cells are making gives us a really good indication about ovarian reserve. So, if someone is in their early 30s and they're on a roll with their career and they don't want to slow down, maybe this is a great candidate that we just at least talk about egg freezing. So
I agree. There's this movie. There was one of my guests, my early on when I first started the podcast. Her name is Pepper Binkley,
Mm.
and she has this movie. It's really cute. You should watch it. It's a little like it's a series, and of a bunch of different episodes, and it's called It's Freezing Out There, and it's kind of humorous, but it's just great, and it really gets you thinking, and it's a great message also to give a lot of women who are watching or to bring out, because it is something that people should think of. And I've just think about it.
Well, if we could freeze our 30-year-old eggs that are in great
Yeah.
shape. When I was in the fertility clinics all the time, I heard from women that were, maybe in their early or mid 40s, and then they were at the fertility clinic and they were saying, I wish someone would have told me. I wish someone
Yeah.
told me that your egg quality can decline so quickly, and maybe I would
Hmm.
have known to be more proactive about it. And I think that's the other piece, is that we know that there's so many things that we can do, with a phytonutrient rich diet and mitochondrial support, whether that's, CoQ10 or Institute for Functional Medicine, where I work, has a great mito food plan that's targeted nutrition for mitochondrial support. So what's the hurt in getting those on board early? Because
Yeah.
there's so many things that we can do to support egg health and reduce ovarian aging, but we need to do them now.
Yeah. I agree.
So
I agree with you
I
100%.
always feel so strongly about, we at least need to get the word out because people need to
It's true.
informed choices about their future. And to do that, they need all the information.
I almost feel like this should be like a lunch and learn at all corporate places, you know?
Yeah. Yes.
You know what I'm saying? Because that's really where a lot of these women are in their 30s, focusing so much on work.
Exactly. And it's funny that you mentioned that because here in Seattle, where I am, we have, Microsoft, and they have really increased their coverage of fertility services. And I have seen a huge uptick in, women working in the corporate world that are exploring, egg freezing because they have
That's great.
all this increased access to it. And I think I was surprised, even me, of how many people would take advantage of that if it was available.
Yeah, that's great. I'm really pleasantly surprised.
Yeah, it's been interesting to watch. So I think that the future is bright as long as we keep spreading the good word that we have some say in how our eggs hold up, but we got to do it now.
Yeah, without a doubt. And actually wanted to double back on the gut health.
Hmm.
How many food allergies do you tend to see nowadays?
Yeah, so food allergies are a big deal, and I think that you know food allergies and how I always think about them is their relationship to inflammation, and inflammation being really problematic in terms of ovarian function. I've even seen papers that the inflammation from gut issues causes inflammation in the ovary to the extent that progesterone production is impaired, and then that leading to
Really?
phase dysfunction. And we know that when we see the luteal phase that's less than 11 or 12 days, it's really hard to get pregnant when your luteal phase is short. And so just as a
Right.
luteal phase is the period of time from ovulation until your next first day of bleeding. And so I'm pretty concerned about any underlying sources of inflammation, and food allergies are certainly one of them. And I think what I feel thankful for is, through the Institute for Functional Medicine, I've had some advanced training in the elimination diet. So I feel
Hmm.
like we can trial in an elimination diet and see what happens. And maybe the outcome is that your energy is better, and then that makes you more excited about your partner. Like maybe that's a great side effect. But let's also uncover what's going on with your gut and your immune system, because we want to make sure that those things are in good working order before you get pregnant.
Yeah, absolutely. I agree. I mean, the elimination diet, because I know that you can get tested, but I don't know how detailed
Right.
and accurate some of the testing is. I mean, that's just what I've heard. There's some that are good, and then sometimes there's certain food allergies that don't come out
Right.
in the testing. So it sounds like the best way to really figure it out is just eliminate.
I mean, the elimination diet is the gold standard for identifying food allergies. And yes, we do have so many food allergy testing options, but like you're saying, it's complicated and you have to interpret them with some care. And, if someone's having symptoms, then I think let's do the elimination diet and get your symptoms better so that not only do your labs get better, but your quality of life is better.
Right. Absolutely.
It's a
So,
deal.
so what is fertility focused telemedicine?
Yeah, I'm really excited. I'm feeling so excited about telemedicine. I'm building this new telemedicine practice, and it involves, it allows a secure patient visit with a doctor over an internet platform. And I feel like this is such an exciting time to be alive that we can have a visit with a doctor from the comfort of our own home without a commute. And that allows, I hear often people, send me messages on social media or emails or whatever, and they say, I just don't have someone like you that's needed.
Hmm.
And how do I access your services? And so I feel so excited to be able to bring that to a larger demographic. And what's really exciting is, for people who live in Washington State, which is where I live, I'm able to order their labs and prescribe, supplements, medication, nutraceuticals, and really give them a comprehensive treatment plan. And that feels so exciting to me. And then, for those who live outside of Washington, I can serve as a consultant role, and we can work with their primary care doctor or their care team and make sure that they're getting really excellent, preconception care, hormone care, whatever concern that they have. And this is what I love to do. And so I feel so grateful that I can bring this specific set of skills to whoever needs me wherever they are.
Yeah, absolutely. I think it really is a great time. And I feel the same way. I'm starting to really understand the whole online thing, or I'm like learning about it. But it is amazing to be able to reach so many different people and allow them to have at least some kind of guidance. And especially, it's true, I don't think a lot of people like you doing what you're doing are in many parts of the US. I mean, there's some places that they don't have any naturopathic doctors.
Exactly. Yeah, exactly. It's a specialized field, and I feel like everyone deserves the kind of care that they want. And access to care, I think, is a much larger conversation in the field of medicine, but being able to reach anyone who is seeking your services is, I mean, that's the future of medicine, I think.
Yes, it definitely is amazing. The internet, I mean, it's a blessing and a curse, but I think I'm seeing a lot more blessings now. It's finally like settling out. People are able to like manage it. But there are so many amazing opportunities and an ability for so much connection to everywhere internationally.
Exactly. It's an emerging field, and I'm excited to see what happens with it.
Yeah, for sure. So, are there any inspiring stories that you'd like to share?
Yeah, I was thinking, I think I would love to. We've been talking a lot about personalized lifestyle medicine, and I thought I would share just a really brief story that really highlights how useful this can be. And the case that I thought would be fun to talk about was a woman who I met, and she was in her early 30s, and she had tried for 3 years to get pregnant, and she was finally successful on her third round of intrauterine insemination, or IUI. And she had planned with her doctor and her husband that they were going to try this one last IUI, and if it didn't work, they were going to move on to IVF. So that last cycle, it worked, and she's so excited, and
Mhm.
had a baby girl. And then when I met her, her baby was, I think, around 18 months, and she said, I want to start to try to get pregnant in about 6 months, but I'm having a lot of anxiety because it was so challenging last time. And I'm too anxious to do anything crazy, but I just want to start moving in the right direction. And so I said, okay, we're going to keep this really simple. She, had a history of PCOS. So we worked on moderate intensity exercise most days per week. We called in some myo-inositol, which is one of my favorite supplements for women with PCOS.
Yeah.
Reproductive endocrinologists I know are using it for ovulation induction. It's working just as well as metformin, which is mind blowing.
I know it's pretty
It's
amazing.
amazing. And so I have so much faith in myo-inositol. So we brought that on board. We did the Mito Food Plan, which I mentioned before. It's from Institute for Functional Medicine, and it's this really targeted nutritional plan that has so many very specific therapeutic foods to really power up the mitochondria. And I think this is so important because the ovaries are the most concentrated source of mitochondria in the body. Those
I know.
powerhouses
It's
of our
pretty
cells. So
crazy.
I'm like, anytime there's ovarian dysfunction, let's make sure that the mitochondria is doing well. So we did Mito Food Plan. We got her on some CoQ10 again for mitochondrial support. And then we brought in some resveratrol. So it's both an antioxidant, so protects egg quality, but it also has been shown to increase sex hormone binding globulin, which binds up, excess hormone, which is an issue in PCOS. So kind
Mhm.
of, started with these really simple interventions. We'll see what happens. We'll, give it a couple weeks, a couple months, and just kind of take it easy. And then she, 8 weeks after doing all of this, sends me a picture of a positive pregnancy test. Told
Oh, wow. That's
both of
amazing.
us.
Yeah.
And I know that this is like one of those
That's
stories that
awesome.
has a really miraculous outcome, and that we know that, most stories in life don't end up like this. But I think this
Yeah.
really underscores the power of simple changes. Like, we don't have to do crazy things, it's a stepwise process, it's one thing at a time, and that it can make all the difference in the world. And I just was so encouraged. I think we were all really excited about it. So I thought I would just highlight lifestyle changes, simple things, bites
Right.
out of it one thing at a
Yeah.
time. It's powerful.
It is. It is. I mean, it is. It's like such a simple thing. It doesn't really take that much out of your comfort, normal, like routine.
Yeah, exactly.
That's awesome. Well, thank you for sharing that.
Thanks for letting me gush about it, because it's always just the success stories are what, keep us going.
It's true. It really does. I mean, it's inspiring also for other people to hear because it gives hope.
Right, right.
Is there a tip that you would like to share?
Yeah, I think what I want to say to offer a tip is to loop back around to what I said earlier, and just for any woman of reproductive age, I just encourage everyone to know that you have so much power to positively influence your fertility and to shift yourself on that fertility spectrum to be, more towards optimal fertility, even if you aren't trying to get pregnant tomorrow. And find someone that can help you support your nutrition, your stress management, your toxic exposures, because all of those things are determinants of your future fertility. And whether or not that results in pregnancy, or whether it's just your hormone balance, which really contributes to your quality of life, especially as you're aging, these are, so important. And it's a lifestyle. It's a way that, we can live to be healthy. And so I think that that's my tip, of knowing that you have some power to do things, and that if you do them now, it will really pay off in the long run.
Yeah, I mean, it should also, just for your own body, it's going to increase your own quality of life. So even just for that, it's so important.
It's so important. Yes. So that's my top tip.
Awesome. Thank you so much for sharing it. And where can people find you?
So, a couple different places. I love social media. And so I'm on Facebook, Functional Fertility. I'm also on Instagram at Functional Fertility. And then my website, that is currently under construction but will go live just anytime, is functionalfertilitydoc.com.
Awesome. Well, I really enjoyed this interview. You and I definitely have a lot in common,
Yeah.
and we definitely think alike. So it was so much fun to interview you and have you on the podcast. And I'm sure many people are going to benefit so much from listening to you speak and everything that you've talked about, because it really does make sense. And it's something that is so based in logic as well. So thank you so much for coming on.
Yes, thank you so much for having me. It's just amazing how nourishing it is to be able to share what you love and to connect with other people who, care about a lot of those things too. And so I feel very refreshed and renewed from being able to chat with you. So thank you so much for having me.
Awesome. Thank you.
All right, bye-bye.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters, and I will be giving shout outs to the usernames of reviews on future episodes. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program, which will be available online soon. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors, as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates, as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I am also offering a discounted pre-registration price for a limited time. If you're interested in that, you can contact me on my contact page. I thank you so much for listening in and hope you have a beautiful day.